Can you tell us about the departure of the CCDP's medical director, Dr. Bested, and then your subsequent departure from the program as well?
Well, Dr. Bested left because she was an absolute dynamo, and she was doing everything she could for good patient care to get the treatment that the Lyme patients needed, but she just ran into so many obstacles to getting the mandate met for the Lyme disease patients. And there was obstacle after obstacle, and actually she wasn't the only one that left. There was myself, another physician, and Dr. Bested, who all resigned, and a psychologist at the program, really in protest to the administrative restraints that occurred in our carrying out the mandate of the program. I left because I felt that there was no hope to make the changes from the inside that I was staying to try and make. I felt that Lyme disease needed to be treated appropriately. It's a bacteria, and it needed to be treated with antibiotics, and that we were doing very important things by giving them access to social work and physiotherapy and psychological support, but if we had no treatment with antibiotics for bacterial infection, we were really missing the mark, and the patients were not getting the services they needed. The mandate at the clinic was better testing and treatment for Lyme disease, but when I was at the CCDP, we did nothing for better treatment, nothing for better testing, and in fact all of our resources were more directed towards coping with chronic illness. I'm getting calls all the time, emails all the time about, I think my patient might have Lyme disease, what should I do, where should I access information? People are more interested, they're recognizing that it's here, they're putting it in their differential diagnosis. When somebody comes in with unexplained symptoms, they're not just saying, well, is it MS or not MS? They're saying, could it be Lyme disease? So we're seeing more and more that physicians are considering that as part of the potential reason for patients' illness. So the awareness is definitely happening.